Wellness Wednesday with Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
The power of the pause.
Exactly.
That was beautiful, Dave. Good morning.
Dramatic pause. All right. Well, you have a special guest today. This is going to be fun.
Yes. My new colleague, Matt Garred. He started a few months ago. He is going to be a nice addition to the clinic. And we look forward to the weeks and months and years ahead to see what wonderful gifts he's going to share with us in the greater Northwest Iowa, Southwest Minnesota area. So I've got him here today. He'll be able to share a little bit about what his focus is going to be, what his interests are, and how he plans to integrate into the Okoboji Wellness mission. Again, we're out there to offer hope where folks have lost hope and think outside the box, utilize tools both inside and outside the box, and really work and walk with that patient as they work on their healing journey. So thrive, not just survive. And that takes a team of folks that come on with different levels of giftings, and so he's got a lot of giftings. Here's Matt.
All right.
Good morning, Dave. Thanks for letting me be a part of your show this morning.
Absolutely. Glad to have you, Matt. First of all, I need to congratulate you and your wife. You have a newborn at home, so congratulations on that. You now have a family of 5, I believe.
Yes, that's correct. My wife, Laura, and I, we're going on almost 12 years of marriage now. I tell everyone she's not my greater half, she's my greater 3/4. And then I've got 3 kids now. So my firstborn is Samuel, and he's 6.5. Lena is my daughter. She's 1.5. And then the new baby is Theodore James, and he was born back on the 10th. He was 19.5 inches long, 8 pounds, 2 ounces, and we call him Teddy for short. So, and he has been very quickly welcomed into the family.
Very cool. Well, congratulations on that. We look forward to seeing your family grow. So let's have a little bit of your history. Where were you practicing before you made your move to Okoboji Wellness Clinic?
Yeah, great question. I was actually born and raised 30 miles south of Sioux City, Iowa, in a little town called Whiting. My background, before I met up with Brad here a couple of years ago and then started practice with him here just a few months ago, my background actually was not in healthcare hardly at all. It was actually in music. So kind of a long story cut short, I'm a third-generation healthcare professional. My grandfather was a general surgeon and practiced all the way up until the age of 92 when he passed away. My dad was also a general surgeon. He trained and then came back to practice with my grandfather. And then I actually started out in music. I majored in low brass, and I'm a collegiate-level musician. I do guitar, keys, and bass as well. And I thought I was originally going to go into music ministry and be a part of a mega church in Sioux Falls, but I'd also had this idea of also going into the military and being a pilot. And so the Lord kind of directed my ways through all of that. And then after I graduated with my music degree, the Lord said, no, you're going to go back to nursing school. And I said, what? So I ended up graduating from Creighton's accelerated nursing program. I did a bachelor's of science in nursing in 12 months. It was the craziest year of my life, but that was when I also was dating my wife at the time, and it's just been an adventure ever since. I have a background in ICU, critical care, and cardiac cath lab nursing. We did literally anything and everything at UD Point Health St. Luke's in Sioux City. Did that for about 6 years, and then decided to transition back home to work with my dad for a couple of years while I was doing family nurse practitioner school. And then I had the honor to be able to practice with him for a few years before he decided to retire. And we worked in a critical access system down in Ottawa, Iowa called Burgess Health Center. And then after that, I decided to do a practice on my own and see what this direct primary care movement was all about. And so I took care of about 100 patients for about 2.5, 3 years. And I was also working as a worship director for my hometown church, Whiting Christian Church, for 6 years, starting to get a little lonely working by myself. And so Brad and I became friends roughly around the same times when he started Okoboji Wellness Clinic. And so we'd always stayed in touch over the years. And so he and I had a conversation, and he asked me if I'd be interested in relocating and hanging out with him. And so we decided to go for it, and it's been a blessing to be here, and I just am grateful for the opportunity.
Much like the growth of a family and how fun it is to watch, it's been fun to see the growth at Okoboji Wellness Clinic, and you're brought on board to continue that growth, to be part of the team. And from what I understand, you have a real passion for families, especially children, and of course you have a passion for the direct primary care model.
Yes, that's correct. So a lot of the patient opportunities I've had over the years, critical care was great. I really enjoyed that, but it's kind of hard to build patient-clinician relationships with people who are on ventilators and are really too sick to have lengthy conversations. And so you get to build really good relationships with the families, but not necessarily the patients themselves all the time. And so when I transitioned to family practice, I've loved doing ministry with middle school and high school youth groups. That's how I kind of got my big start in music as a guitarist and a bass player as well. And so I've always tended to gravitate towards that. And then that eventually morphed into being able to build more relationships with families, young families with younger patients. Just as a little bit of additional background, our family is currently homeschooling our kids, and it's going really, really well. We use a couple of different curriculums, and so we've been able to build really, really good relationships with the homeschool communities down in Monona County previously when I was doing my own practice, and I'm looking forward to tapping into those opportunities up here in Dickinson County, and it's going to be, I think, a really good opportunity to build relationships here in our local community.
So, Matt, let's talk a little bit about the integrative space for healthcare. We've seen a lot of that develop over the last 5, 6, 7 years. Traditional practitioners have kind of integrated that way of practicing medicine. And one thing that I know that Dr. Meyer does at Okoboji Wellness Clinic is you don't have that strict facility protocol where you're talking about 7-10 minute appointment times. Some of these appointments at Okoboji Wellness Clinic may very well indeed be an hour.
Yeah, that's a great point. And one of the things I really appreciated about the direct primary care model was that it took a lot of the middlemen out of the patient-clinician relationship, and it allows us to reinvest that time back into the patients and reinvest into their health. One example that I can give you even just happened yesterday. We ended up having an entire family come in, and instead of just itemizing each one of those children's visits, we actually put all of them in the same room, and we basically it was like a big old family meeting, honestly. It was a really cool dynamic to be a part of. It seems to me that homeschool families sort of like to do that in multiple instances, and so that's totally fine by me. It was really cool to be able to engage with both parents and all 5 kids all at the same time. And, the direct primary care model definitely allows for a lot more flexibility of time with that. And then there might be some instances where, you have 3 kids that are doing really well, but then 2 of the kids might need a little bit of extra time. The schedule definitely allows for flexibility with that. And to even speak on top of that, I've been even more grateful to see just other patients in the DPC system. When you have a subscription service like that, and when you know that you're not going to have to be nickeled and dimed for everything, but rather it's just on a monthly basis, they feel more open to being able to share things with you just on a short basis, or if it requires that longer time visit, you definitely have that ability to flex up or flex down. But they're also recognizing that other patients have that service too, and so they'll say, oh, it's okay, I can just come back on another day. And then everyone seems to agree on it really, really well. It's not nearly as regimented compared to the conventional method, which I used to be a part of.
So, Matt, I want to ask you this. I know you had a relationship with Dr. Meyer previous to jumping on board, but when you first set foot in Okoboji Wellness Clinic as part of the team, that first week or two, what were your impressions of Okoboji Wellness Clinic?
first and foremost, it was abundantly clear to me, or frankly, how little I truly knew about the human body and just what's available out there. Anecdotally, in my previous practice in the conventional method, I was traditionally trained in nursing school with, all of the Western methods and different things. And when I was starting to get into practice as a nurse practitioner, even in our critical access system, Monona County at that time, I don't know what the current numbers stand now, but it was one of the poorest counties in the state of Iowa. And so a lot of people were not wanting to come to the doctor, and they were seeking out alternative methods and supplements and, naturopathic solutions. And so it honestly forced my hand to read up more on some of that stuff. And even with the extra textbooks and things I purchased, I was very grateful to come into the clinic here and just be surrounded by people that are experts in their own fields. And it's like you're walking into a building where there's walking encyclopedias all around you when it comes to their own respective disciplines. One example I'll give you in particular is Molly Avery. She's our nutrition and our food expert here. And I didn't realize that a person could be a walking encyclopedia when it comes to gut bacteria and different foods and nuances that can make those grow or recede. And so that just absolutely blew my mind to be able to talk with her for the first few days and just to see what her wheelhouse was. Another gentleman, Dr. Meyer has his own merits to stand on. I don't think he needs an introduction by any stretch of the means, but just all the stuff that he's learned over the years about ozone and vitamin C and hyperbarics, that has been a tremendous blessing to be able to learn underneath him. Mychal Sheridan is one of our trainers here and does a lot of stuff with neuromuscular connections, and I still need to sit down with him more because even the stuff that he does I don't fully comprehend, but obviously his outcomes they speak for themselves. And his schedule speaks for itself as well because he's very hard to get into nowadays. So just being able to learn from all these guys and the grace that they have with me, who just asks probably way too many questions. I'm probably more annoying than anything else, but it's been a true blessing to be able to learn from all these folks here.
Well, awesome. Well, Matt, welcome to Okoboji Wellness Clinic. Congratulations again to you and your wife on your newborn. We hope that Okoboji Wellness Clinic and the Dickinson County area is a great place for you and your family, and we look forward to talking to you in the future, and I'm sure we'll have you on many times as you become a full-fledged team member and colleague with Dr. Meyer at Okoboji Wellness Clinic.
Awesome. Dave, thanks for letting me be a part of your show and for being a guest today. Appreciate you guys.
Absolutely. Dr. Meyer, Matt brought up something, and before I let you go, I'm guessing you're going to be familiar with this name, but you were kind of one of the first ones on our airwaves that started preaching about gut health and how much it had affected our entire body. I have been following Sabine Hazen. I'm not sure that's how to properly say her name. For quite some time, she was one of the people that got COVID right from the beginning. I guess her job is a gastroenterologist. This Sabine Hazen, when it comes to gut health, she has taken a deep dive here, and boy, she has laid out a pathway to how the gut really affects nearly everything that we do.
Yeah, it's another one of those new frontiers, that big discovery with it. And again, as we've applied that to our practices here at the Okoboji Wellness Clinic, it is foundational. And if nutrition and digestion are not part of the plan, then we're not going to get the complete results that we're hoping for. It's that big of a deal. And, again, we can do all these amazing other things and modalities and ozone and hyperbaric therapy, oxygen therapies, neurofeedback, and so on and so forth. But if you are not working on some of those foundational things at the same time, I always say, with the hyperbarics, it's like that's a big fire department. It puts out a lot of inflammation, helps put out inflammation in the body. But if you got a lot of arsonists, a lot of folks out there lighting fires, we want to identify them, and one of the big ones many times is that gut. And so that's got to be rectified and rehabilitated in many cases because, as you said, it is the microbiome in the gut is connected to every part of the human body. It has connections, so hugely impactful. So the big thing I think as Matt comes on board here too is wanting to invite the younger families, and because we have our families that come in, and we've got, the under 40 crowd and kids, but it's nice to work with folks too, to work on the whole prevention piece at a younger and younger age. It's easier to get the ball rolling in the right direction in many cases when we're starting a bit younger. There tends to be not as many things that are quite out of balance at that point. And for instance, yesterday it was great. We had a young gal come up from Des Moines and starting her journey with us. She's 24 and a nurse, and big piece for her is bloating and gut dysbiosis, gut imbalance. So we're going to start that journey with her. It's super, super exciting. So if you're out there and you're under 40, sometimes we don't want to wait for all these really bad symptoms to develop, or we don't want to just, kind of cast them aside to say, oh, I've got some nasal congestion or allergies, or I've got a little bit of brain fog. That's your body telling you something, and those things add up over time. So the little bit of investment in yourself earlier in the course of your life can pay dividends down the road in a big way. So yep. Matt is going to really focus on the movement piece. We have PNOE metabolic testing that we do here to organize kind of a game plan through how efficiently you burn energy and looking at fat and carbohydrate metabolism. And so he's going to run with that. And so many folks are not happy with where they are from a weight release perspective, metabolic perspective. And he's really going to dig into that and provide some paths forward once it's data points too, Dave. So we got to measure that mitochondria, and that's part of that PNOE metabolic testing that we do here at the clinic. And so he'll sit down and organize a path forward. Everybody's a little bit different. He's got background in nutrition as well. Work with the team to develop the best game plan for you to reach your goals from a movement perspective and a metabolic weight release perspective. So lots of exciting things, because a lot of folks, you'll hear from your doc, hey, you just got to eat less or move, burn more calories and eat less. And it's like, well, how do I do it? It's like kind of nice to have somebody that's going to walk alongside you and draw up that path. And he's very good at developing and cheering you on during that path and that journey. So those of us that are, part of that direct primary care model, if you decide that you're like, ooh, I want to kind of work on this metabolic path, how well do I burn energy? What does my blood sugars look like? What is my metabolism? Am I losing the amount of weight that I want to be? Am I at my ideal weight? He's going to be able to really dig into that on these appointment times that are an opportunity where you can really sit down monthly and have that accountability factor and the adjustment in the plan. So really big piece, I think, in traditional medicine so often, and this is why we want to bring it, even in the integrative, holistic medical world, many times we talk about movement and metabolism, but we're doing it through passive treatments like hyperbarics and ozone. And to bring in the actual movement piece and how to do it and walk alongside what's best for that individual is, I think, been a huge missing piece, and people thriving, not just surviving. So again, he'll be able to kind of dig into that more on future visits and discussions about what he's doing with that, and I think that'll be amazing.
Awesome. Well, if we don't get out of here, you're going to have to add another employee, because I'm going to be fired from my spot here. So thrive, not just survive, at Okoboji Wellness Clinic. Now, Dr. Meyer, how can folks get a hold of you or Matt and set up the journey that they want to get on?
You give us a call at 712-339-6024. We're at right off Highway 71 in Spirit Lake next to Ace Hardware. And we can do this free discovery call, 15 minutes with any of the professionals here. If you want to learn more and how to get going on your journey, and whether it's pain or it's inflammation, whatever the goal may be, you're scratching your head and saying, I just am not feeling my best, then give us a call, get scheduled, and we get moving in the best direction that you can.
Very good. Dr. Meyer, thank you. Matt, welcome aboard, and we'll chat to you both again very soon.
Thanks, Dave. Be well.
Thank you, Dave.
Thank you. Matt Garred and Dr. Bradley Meyer from the Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com.